Your kidneys are two small but incredibly powerful organs. They work tirelessly to keep you healthy. They filter out toxins, regulate fluids, balance minerals, and produce important hormones. But these silent heroes can send signals for help, and often those signals are ignored or mistaken for something else. Today, we'll explore 10 telltale signs your kidneys are sending you to warn you. Each of these signs can be an early indicator of problems, which, if caught early, can be treated to avoid bigger issues. Stay with us as we break down each symptom and find out how you can protect the health of these vital organs. So, changes in your pee. The first sign. Your pee is one of the most direct ways to tell how healthy your kidneys are. Changes in its color, how often you pee, or what it looks like can all mean there's something going on with your kidneys. Peeing more often, especially at night, could mean your kidneys aren't filtering fluids like they should. You might even see a reddish or brownish color in your pee, which could mean there's blood in it. That's called hematuria. This is a serious sign you should never ignore, as it can point to infections, kidney stones, or even tumors. Also, if you see foam in your pee, it could mean there are proteins in it. This is a symptom linked to conditions like proteinuria, often seen in kidney disease. Each of these changes is your body's way of telling you something might be off with your kidneys. Second, let's talk about swelling in your hands, feet, and face. One of the biggest signs that something's wrong with your kidneys is swelling in different parts of your body. When your kidneys aren't working right, extra fluid and sodium can build up. This causes swelling, especially in your ankles, feet, hands, and around your eyes. You might notice this swelling more in the morning because fluids tend to build up while you sleep. This swelling is called edema. It can be a sign that your kidneys aren't filtering out waste and extra water like they should. While swelling can also be a sign of heart or liver problems, it's super important to pay attention to this warning sign. If it doesn't go away, talk to your doctor. A simple blood or urine test can tell you a lot about how your kidneys are doing and help you take steps to protect them before things get worse. In third place, constant fatigue. Feeling constantly tired and weak can be more than just a long day. Long-lasting fatigue can point to kidney problems because these organs are in charge of making erythropoietin, a hormone that helps make red blood cells. If your kidneys aren't working well, the levels of this hormone go down, which can lead to anemia. This means your body isn't getting enough oxygen, which makes you feel tired all the time. Also, the buildup of toxins and waste in your blood because of the kidney problems can also add to overall weakness and make it hard to do everyday things. If you're dealing with tiredness that you can't explain and doesn't get better with rest, it's time to think about a medical checkup to rule out any kidney problems. At number 4, lower back or side pain. Lower back or side pain is a symptom that's often ignored, but it can be directly related to kidney problems. This pain can be caused by different conditions, like infections, kidney stones, or more serious problems, like kidney failure. Although this symptom can be confusing since lower back pain can also be linked to muscle or spine issues, it's important to pay attention to the intensity and how long the pain lasts. If you have a kidney infection, the pain can come with a fever, chills, and pain when you pee. On the other hand, kidney stones usually cause a sudden, sharp pain that can spread to your stomach or groin. If you feel this kind of pain, don't ignore it. Talk to a doctor to get tests done to figure out the exact cause and get the right treatment. At number 5, trouble sleeping. Not being able to sleep or having trouble sleeping all the time could mean you have problems with your kidneys. When your kidneys aren't working right, they don't clean the bad stuff out of your blood like they should. This can make you feel bad all over and mess up your sleep. Also, people with kidney problems often have something called sleep apnea, which is when you stop breathing for a bit while you're asleep. This can make you snore really loud and not sleep well, so you wake up feeling tired. It's really important to sleep well because that's when your body fixes itself and all your organs, including your kidneys, can work their best. If you're having trouble sleeping and you have other problems that might be because of your kidneys, go see a doctor to find out what's going on and how to feel better. At number 6, bad breath and a metallic taste in your mouth. The buildup of toxins in your blood, known as uremia, can cause changes in your mouth and make your breath smell bad. People with kidney problems often say they have a metallic taste in their mouth, which can change how food tastes and make them not want to eat. This might seem like not a big deal, but it can really affect how you eat and how you feel overall because not eating enough can make you lose weight and feel even weaker. Plus, having bad breath because of all those toxins can be embarrassing and make you feel bad about yourself. If you notice these changes, it's important to do something quickly because these could be warning signs of kidney disease. Seeing a doctor and getting some simple kidney tests can help fix the problem before it gets worse. Seventh, itchy and dry skin. Dry, itchy skin can be more than just a surface problem. It could be a sign of internal imbalances caused by kidney problems. When your kidneys aren't working properly, they can't maintain a healthy balance of minerals and nutrients in your blood. This can show up on your skin. Also, the buildup of toxins that aren't being properly removed can cause persistent itching and, in some cases, even rashes. This symptom can be really annoying and impact the quality of life for those affected. If you notice changes in your skin along with other signs of kidney problems like swelling or changes in your urine, it's important to see a doctor. Early diagnosis can help identify the underlying cause and implement effective treatment to relieve symptoms and improve your overall health. Be careful, always feeling cold. Always feeling cold, even in warm places, could be a sign that your kidneys aren't working properly. This symptom is often linked to anemia, a common condition in people with kidney disease. With low red blood cell levels, your body can't carry enough oxygen to your tissues, which can make you feel cold all the time. Also, the buildup of toxins in your blood can affect how your body regulates temperature, making you feel even colder. If you're always cold and you have other symptoms like tiredness or changes in your pee, it's really important to see a doctor. A simple checkup can find any underlying problems and help you take steps to protect your kidneys and improve your quality of life. Number 9. Difficulty breathing. Feeling short of breath can be scary and is often linked to heart or lung problems. However, it can also be a sign of kidney disease. If your kidneys aren't efficiently removing excess fluids, these fluids can build up in your lungs and cause breathing difficulties. This symptom may occur especially during physical activity or even at rest, and in severe cases, it can feel like you're suffocating when lying down. Additionally, anemia, common in people with kidney disease, can reduce oxygen supply to the body, worsening shortness of breath. If you experience this symptom, it's important to see a doctor immediately, as it could be a sign that your kidneys need urgent help. At number 10, lack of appetite, nausea, and vomiting. Loss of appetite, that icky feeling of nausea and throwing up, are symptoms that usually show up in the later stages of kidney disease. These symptoms are linked to the buildup of toxins in your blood, which mess with your digestion and overall well-being. Even the thought of eating can become really unpleasant, leading to eating less and often significant weight loss. These symptoms don't just affect your nutrition, but they can also be a sign that your kidneys are getting worse. If you notice a bunch of these signs together, along with other issues like swelling or changes in your pee, it's super important to talk to a doctor. Figuring out and treating the root cause can make all the difference between early intervention and serious complications. Taking care of your kidneys is super important to avoid serious health problems. Even though they're tough organs, they need healthy habits to keep working properly. Here are the best ways to protect them. First things first, stay hydrated. Drinking enough water, about 4 to 6 glasses a day, helps your kidneys flush out toxins and waste products. But don't overdo it. Drinking too much water can actually be counterproductive. Listen to your body and adjust your water intake to your daily needs. A balanced diet is key. Cut down on salt, sugar, and processed foods. Instead, go for fruits, vegetables, lean protein, and whole grains. Avoid foods high in phosphorus or potassium if you already have kidney problems, and limit red meat and heavily processed foods. A balanced diet also helps control blood pressure and diabetes, 2 major risk factors for kidney disease. Regular exercise is crucial. Activities like walking, swimming, or yoga can improve blood flow, maintain a healthy weight, and reduce the risk of chronic diseases. However, avoid excessive physical exercise that can lead to dehydration. Monitoring your blood pressure and blood sugar is of utmost importance. High blood pressure and diabetes are the leading causes of kidney damage, so keeping them in check is vital. If you suffer from either of these conditions, follow your doctor's instructions carefully. Avoid the overuse of over-the-counter medications like non-steroidal anti-inflammatory drugs, as they can harm your kidneys in the long run. Similarly, only take antibiotics when absolutely necessary and under medical supervision. Quitting smoking and reducing alcohol consumption are important steps to protect your kidneys. Smoking affects blood flow to the kidneys, while excessive alcohol intake can overload their function. If you're struggling to quit these habits, seek professional help. Finally, get regular medical checkups. If you have a family history of kidney disease, high blood pressure, or diabetes, or if you're over 60, regular blood and urine tests are essential. These simple tests can detect kidney problems early on and prevent serious complications. By incorporating these measures into your daily life, you'll not only protect your kidneys, but also improve your overall well-being. Small changes in your routine can make a big difference. Take care of your kidneys and enjoy a healthier life. Your kidneys play a vital role in keeping you healthy, and paying attention to warning signs can help you catch problems early. Don't ignore what your body is telling you. If you notice any of these symptoms, talk to a doctor to get a proper diagnosis and take preventive measures. Remember, a healthy lifestyle with a balanced diet, enough water, and regular checkups is key to protecting your kidneys. Take care of them, and they'll take care of you.